Good afternoon, everyone. I'm Shilpa Fadkin. I'm the Vice President of the Women's Initiative here at CAP. On behalf of everyone at the Center for American Progress, we really want to welcome you for this incredibly important conversation we're going to have today on a very special day and occasion. As many of you here know, people around the world will join together to celebrate the 107th almost, anniversary of International Women's Day. Yeah, I know, yay. It's a time to recognize all the amazing trailblazers who've devoted their lives to expanding equality on behalf of women everywhere, and to rededicate ourselves towards empowering the next generation of women leaders. Right now, our work to fulfill this mission is more important than ever before. Last year, just 3 days after entering the White House, Donald Trump signed a new Global Gag Rule, a heartless policy which strips vital health care resources from millions of women across the globe. The gag rule doesn't just deny women the right to exercise control over their own bodies, it impacts nearly $9 billion in funding across an array of very basic services. I don't have to tell you all this, but you know that the rule affects moms who need health care during their pregnancies, teenagers who are in danger of contracting HIV, young women and girls who can't afford modern contraception. And of course, the president hasn't limited his attacks on the dignity of women to the international community. His administration has launched an all-out assault on women's rights right here in the United States. His allies have attacked Planned Parenthood. They've weakened federal protections for victims of sexual assault. They've appointed a slew of judges who are determined to deny women their right to choose. So it should come as no surprise that women have helped fuel the resistance against Donald Trump, not just in the United States, but around the world. Here in America, 2017 started with the Women's March. We saw the Me Too movement with women raising their voices, and in between, women around the country are running for office and really making their voices heard. I think at one point last year, women accounted for 86% of the anti-Trump phone calls being made to Congress. On the global level, an international coalition of women have forged new organizations like She Decides to fight back against the gag rule. And as we mark International Women's Day, it's up to all of us to keep the momentum going, to translate the energy into real change, so we can figure out how we can get to a future where women actually run the world. So we are really excited to host this conversation. We have an amazing lineup of panelists, but first I have the incredible honor of welcoming our keynote speaker, Senator Jeanne Shaheen of New Hampshire. Throughout her career in public service, Senator Shaheen has been a tireless champion for women and girls. She co-sponsored the Lilly Ledbetter Fair Pay Act. She led the effort to reauthorize the Violence Against Women Act. She's helped introduce a bill to repeal Trump's Global Gag Rule. She's also a trailblazer in her own right. She was the first woman in American history to be elected as both a governor and a member of the United States Senate. And we're just very grateful for her leadership. And after her brief remarks, she will take a couple of questions, so get those questions ready. So please help me welcome Senator Shaheen.
Well, thank you very much for that very generous introduction, and good afternoon, everyone. Welcome. Thank you all for coming out today. Fortunately, the bad weather has moved on to New England, where I'm headed. So, but thank you also to CAP for hosting this event today and for doing so much to, yes, we should applaud CAP for the great work that they're doing. And for continuing to beat the drum on the importance of issues that address women's reproductive health. And I think it's important to be very clear that access to family planning is not a women's issue. It is critical to economic development and to social progress for everyone. This is an issue that affects everyone. Just to frame today's discussion, I want to quote from the United Nations Population Fund's most recent Family Planning 2020 report, which I think pretty much says it all. Every woman and girl, and I'm quoting here, every woman and girl must be able to exercise her basic human right to control her own reproductive health. Access to safe, voluntary family planning is fundamental to women's empowerment. It's also fundamental to achieving our global goals for a healthier, more prosperous, just, and equitable world. Rights-based family planning programs have a greater ripple effect than almost any other development investment, from saving lives and improving health to strengthening economies, transforming societies, and lifting entire countries out of poverty. It is the surest path to the future we want. I know that the panel discussion is going to get into that sentiment in greater detail. Now, sadly, the Trump administration is leading us in exactly the wrong direction. Indeed, this administration and Republican leaders in Congress have exhibited a dangerous obsession with rolling back women's reproductive rights, both domestically and abroad. In one of his first official acts, as we heard, in the White House, the president signed an executive order reinstating and greatly expanding the so-called Mexico City policy, or the Global Gag Rule. And that's exactly what it does. It prohibits U.S. funding for international women's health organizations, so much so that even a mention of abortion as an option for their patients as part of delivering comprehensive primary and maternal health care would deny organizations access to U.S. assistance. In fact, the Trump administration's gag rule is even more extreme than in previous Republican administrations. In the past, this policy applied only to family planning funding, but as you heard, under this administration, it applies to every health program that receives federal funding for global health assistance programs. This puts at risk 15 times more funding and millions more women and families. It targets some of the most effective health organizations at work in the developing world, including the PEPFAR program. Without funding, these organizations won't be able to provide HIV services, maternal health care, or even counsel women on the risks of things like the Zika virus. Now, we've heard supporters of the Global Gag Rule defend it as pro-life. Well, it is not. That's an Orwellian view of what they're doing. The harsh reality is that it will result in tens of millions of additional unsafe abortions every year, and it will leave millions of the world's poorest women injured, maimed, or dead. Across much of Africa and Asia, unwanted pregnancies and unsafe abortions are a pervasive fact of life. According to Marie Stopes International, in developing countries, an estimated 74 million unintended pregnancies occur annually due to lack of access to effective contraception. Nearly a quarter of these pregnancies, or about 18 million, end in an unsafe abortion, killing or disabling hundreds of thousands of women. Now, at a hearing last June in the Senate Foreign Relations Committee, some of you may remember this, it was Secretary of State Rex Tillerson's hearing, we talked about the disastrous impacts of the expanded Global Gag Rule. And his response when I raised it was that the impact would be, to quote him, minimal. I asked him if he considered it minimal that the expanded Global Gag Rule would result in an estimated 6.5 million unwanted pregnancies, 2.5 million unsafe abortions, and more than 20,000 additional maternal deaths. Well, he said that the State Department supports the rule no matter what the impact on women's health. Now, I don't believe that most people working in the State Department support this rule or that most people working at USAID support this rule. It is a callous disregard for both facts and women's well-being that is unacceptable and shameful. Equally unacceptable is the appalling toll that this misguided policy takes on millions of the world's most vulnerable women and girls. Now, we're just starting to see the implications of the reinstated and expanded Global Gag Rule, and we won't really have a fuller picture until more of these NGO contracts come up for renewal. but early indications are deeply disturbing. In Nigeria, according to the Guttmacher Institute, currently, even without the Global Gag Rule, nearly 40,000 women die each year from unsafe abortions in the country. Experts on the ground predict that because of the Global Gag Rule, there will be an additional 600,000 abortions in Nigeria from now through 2020, and as a result, nearly 10,000 additional women will die. These are the real-world consequences of the Global Gag Rule: more unwanted pregnancies, more unsafe abortions, more maternal and newborn deaths. A number of Senate women had the opportunity this week to meet with two young women from Nigeria who had been kidnapped by Boko Haram. Their stories were horrific. One young woman who was kidnapped at age 14 saw her mother and father murdered before her eyes. They were both forced into child marriage. They were raped, gang raped, multiple times. One of the young women was 9 months pregnant when she escaped, and she had a harrowing story to tell about delivering the baby in a village where she fortunately found one older woman who was still in the village after everyone else had been cleaned out, who helped her deliver the baby, but then because she was still on the run, when the baby was 10 days old, it died, sadly. But these are the young women that this Global Gag Rule would deny access to family planning and contraceptives. And this comes in the face of a terrorist organization like Boko Haram, who is using rape and childbirth as a weapon of war. I asked the two young women, I said, what would you like Americans to know about your situation? And one of the young women said, I think they should know that it's much worse, this was through a translator, that it's much worse than what you've heard from the Shabak kidnappings, which were the ones that got a lot of attention 2 years ago. She said, there are thousands of girls being kidnapped every day in Nigeria. And the translator who was with them said, what Boko Haram's intent is to impregnate these girls and young women and to grow a whole new generation that can be indoctrinated into terrorist ideals. And these are the people that are being denied access to health care and family planning. It's unconscionable. Now, we can't allow extreme ideology to triumph over the urgent practical needs of women and families across the world. To fight back against President Trump's executive order, Senator Susan Collins and I are jointly sponsoring the Global Health Empowerment and Rights Act, the HER Act, which would permanently repeal the Global Gag Rule. And the premise of our legislation is that all women, most certainly including poor women in developing countries, have the right to be informed of all of their health options and to be in charge of their own reproductive decisions. The Global Gag Rule is really premised on a fallacy. It ignored decades of research. In truth, if you're against abortion, you should be against the Global Gag Rule. Because the fallacy is that by banning abortion, or even mention of abortion as an option, this will actually stop abortions, but it doesn't. What it does is deny access to safe abortions, and it has the unintended consequence of dramatically increasing abortion overall. Stanford University researchers studied the impacts in 20 sub-Saharan countries in Africa between 2001 and 2008, when the Global Gag Rule was in effect during George W. Bush's administration. And they found that the number of women having induced abortions more than doubled in countries that were most impacted by the policy. One finding of the study was that when women are denied access to modern contraceptives, they resort to abortion as a form of birth control. We've seen, sadly, similar results here in the United States. When family planning services are accessible, rates of unplanned pregnancies and abortions go down. In the U.S., the abortion rate has dropped to the lowest level since 1943, and that's a success that's directly attributed to the reduced cost sharing for contraception and the increased access in different contraceptive methods thanks to the Affordable Care Act. Yes, that deserves applause. Last year, I served on a task force for the Center for Strategic and International Studies, which produced a report on women and family health. The report offers a blueprint for unlocking the potential of adolescent girls, especially in poor countries across the developing world. In particular, the report addresses what it calls the youth bulge, a dramatic and unprecedented increase in the percent of the total population between the ages of 10 and 24. This youth bulge is most acute in developing countries, and left unaddressed, it will generate high unemployment and instability across the developing world. This will have dangerous consequences not just for those countries, but for the United States and our national security. Access to family planning is a critical component of the blueprint that this report recommends. The youth bulge will be especially dangerous for adolescent girls who don't have access to family planning. With access to family planning, more girls will break the cycle of poverty by staying in school, taking part in the economy, and having children later when they are ready. Now, anti-choice activists and the Trump administration see the reinstated and expanded Global Gag Rule as a trophy of their electoral success. But this trophy is really tarnished by the suffering and deaths of poor women and girls across the developing world. If the Global Gag Rule stands, tens of millions of women will lose access to contraception. And this means many more unsafe abortions and many more women who will die. So I believe we have a simple message on this International Women's Day. So this is the positive side of that very dismal news. And that is that there is a better way forward, that access to family planning, including safe abortion, is a precondition to women's empowerment. And when women succeed, their families succeed, their communities succeed, and their countries succeed. And it's up to all of us to do everything we can to make sure that that access to family planning services is available. Thank you all very much.
Thank you. So we're ready to take a couple questions. Is this on? Not on. Okay.
And if you could just introduce yourself and tell me what your affiliation is, that would be great.
And not statements, real questions. Go ahead.
Is going to come up for a final vote very shortly. Now, the Senate version contained language that you sponsored that would permanently repeal the Global Gag Rule, while the House version would codify Trump's expanded version of it. Yesterday, or earlier this week, Congressman Rogers said that he and Senator Graham had finished working out almost every detail except for 3 issues they had to kick upstairs on the foreign aid spending bill. Do you know if the Global Gag Rule is one of those issues? And do you have any idea if there is a potential compromise solution in the works where maybe the Bush version of the rule will be enacted, or are you expecting full repeal?
I don't know if that's one of the 3 issues that are being kicked upstairs. What I do know is that in past years, when we've been able to include repeal of the Global Gag Rule in the appropriations bill in the Senate, that when it's gotten to the House, that has come out before the final package. And so I would expect nothing less this time, unfortunately.
Hi, my name is Sky. I'm a women's rights researcher with Human Rights Watch. And thank you very much for your leadership on these issues. I was wondering if you could just provide us with a really frank assessment of the HER Act. What needs to get in place in order for this act to pass? Is it really just better luck with the elections? and you know, a real change in the political situation in this country. What's the role of civil society here in the U.S. and of, you know, organizations like mine who work here in the U.S. but also in countries directly affected by this policy? Thank you.
Well, we have had the benefit of having support from Senator Susan Collins and Lisa Murkowski, both Republicans. Sadly, they have been the only Republicans who have been supportive, and so I am not optimistic that we're going to see anything happen in this legislative session. So I think the best option we have is for all of those women who have gotten organized, who are running for office, who are making phone calls and going door to door and getting engaged in the political process to do that so we can flip the House and Senate come 2018 November.
Okay, last question. Okay.
See, that's always a conversation stopper when you say last question.
Okay, I think there's one more right in the back, Taylor.
On the American front, we see a lot of changes in the enforcement and implementation of Title IX under the Secretary of Education. Could you address that, please?
Yeah, we need to replace the Secretary of Education, you know? I don't know how to say it any other way. I mean, the fact is we have a White House, a House, and a Senate, and a cabinet that are all controlled by people who don't recognize why it's important to enforce Title IX, to repeal the Global Gag Rule, to have an ambassador for global women's issues at the State Department who can work internationally, who understand why Planned Parenthood is so important to women's health. And, you know, I think we've got to keep pushing on this White House, on this Congress, but the real change is going to come when we change the makeup of the White House and the Congress. So, thank you.
Well, thank you,
Thank
Senator
you all
Shaheen.
very much.
Really appreciate you here. No, it's wonderful having you here. She has to get back to work, unfortunately, but we need her to do that. So, at this point, I'd love to invite Jamila, the Senior Fellow for our Women's Health Program, and the rest of the panelists up to the stage.
Great. What a great way to kick off the panel discussion this afternoon. So I want to start off by thanking Shilpa for opening up the event, and huge thanks to Senator Shaheen for being here this morning. Can we give her another round of applause? That was amazing. So as Shilpa mentioned, my name is Jamila Taylor, and I'm a senior fellow here with the Center for American Progress. My work for the organization focuses on domestic and international women's health and rights and reproductive justice. And so I am delighted to introduce this rock star panel of women that are here with us today to really talk about not only President Trump's global gag rule, but also how the international community is resisting the policy and where we go from here. So I'll start with introductions and then we'll get right into the panel. So in the middle here, I have Suzanne Ehlers, who is the president and CEO of PAI. Suzanne has worked for the last 20 years to promote women's health and rights empowerment across the globe. She has carried out this work at PAI for more than a decade and has led the organization since 2009. Under her leadership, PAI leads U.S. and global advocacy in international reproductive health and family planning and provides significant financial and technical resources to partners in Africa, South Asia, Latin America to the tune of nearly $1.5 million in 2015 alone. And then next to her, we have Lisa Scheckman, who is the Director of Policy and Advocacy for WaterAid America, a U.S. member of WaterAid International, the world's largest NGO dedicated to providing safe drinking water, sanitation, and hygiene services. She has more than 10 years experience in global health, women's rights, and advocacy, and focuses on women's health and rights and integrated service delivery. And then next to me, I have Emma Nilsson, who is the Counselor for Development for the Embassy of Sweden. Emma joined the organization in 2016 And before that, she was the Deputy Director of the Unit for Multilateral Development Banks, focusing on World Bank Group and the Ministry of Foreign Affairs in Stockholm. She has also worked at the Swedish mission to the UN in New York and has been advisor to the Swedish Secretary of International Trade. And last but not least, at the end here, we have Dr. Anu Kumar, who is interim CEO for IPAS. Anu joined IPAS in 2002 as Executive Vice President. In that role, she oversaw IPAS's fundraising and communications efforts and started a new technical area working with communities and pioneered work on abortion stigma. In 2016, she became the organization's first Chief Strategy and Development Officer and led the organizational strategic planning process, along with fundraising, partnership development, and technical innovation. So welcome to the panel. So in terms of the conversation, I feel like Senator Shaheen really set us off in a good place with the overview she gave of the policy and then sort of where we are, where we need to go in terms of this issue. So what I wanted to do is really start things off simple and ask Suzanne, you know, we heard the fact that under the Trump administration, the Global Gag Rule has actually been expanded. And so can you talk a little bit about what we're seeing that's different in this iteration of the Gag Rule and how it's more damaging and harmful to women across the world?
That's a great question, and you're right that both Shilpa and Senator Shaheen gave us some information, but let's add a little more texture and sort of detail to that. So in previous iterations of the Global Gag Rule, then known as the Mexico City policy, and now ironically known as Protecting Life and Global Health Assistance, we know that the policy doesn't just apply to family planning and reproductive health funding from the U.S. government, which is sort of on the average of $600 million per year. But instead, it applies to all U.S. global health assistance, and that figure is closer to the $8 billion figure that we heard earlier, almost 9. So that's everything from HIV and AIDS, that's maternal health, that's immunizations, that's Zika, that's the whole panoply of really important and life-saving assistance that the U.S. government provides under that umbrella of global health. So that's the first expansion that PAI analysts kind of predicted would be the case before the policy was reintroduced and reinstated, and we were sad that we were right. In fact, in past iterations, PEPFAR had been specifically accepted from the policy, and it is included this time. I guess the second point I would make about what's different this time around is remember that the Global Gag Rule doesn't cut off funding. The Global Gag Rule is a policy that certainly limits and restricts what groups can do with U.S. funding. But it's a separate issue from the funding issue, which unfortunately this time around is also under much more attack. We saw in the President's budget request in FY18 a historic 0 for international family planning. That's down from, again, levels of around $600 million. And in FY19, although we had some advocates within the government that helped push us up a little bit to $300 million, we're still suffering nearly 50% cuts in the President's request for this issue. So those two together form a pretty complicated and toxic cocktail when you've got a really impossible policy with which to work and then severely sort of reduced and decreased funding possibilities for international family planning and reproductive health and for cuts kind of across the global health spectrum otherwise. So that feels to me quite different and quite a bit more dangerous this time around.
Can you share a little bit more? I love the fact that you mentioned the funding situation, and the United States has actually been, you know, the largest bilateral donor of family planning historically. And so can you talk a little bit about particularly those organizations that are implementing family planning programs? You know, what kind of situations are they finding themselves in? I mean, of course, keeping in mind that we don't know the full extent of how this policy is going to be implemented, but what are some of the issues that you're seeing implementers have so far in terms of the policy?
It's a great question, and it's where we're laser focused. I mean, we've had a long history of expertise around U.S. government policy and funding, but we have just as much of a history and expertise on the circumstance for national level partners, because PAI doesn't accept U.S. government funding and never has since 1965. We're able to work in countries like Uganda and Nigeria. We've released case studies just today on both of those countries talking about what we're starting to see as the impact of this policy. And Senator Shaheen said it best. We absolutely don't know the full story, but what we're starting to see is a pretty complicated picture. We're starting to see groups making very tough decisions around life-saving services and the most effective and strategic providers all of a sudden being cut off from funding. We're also seeing that they are curtailed by the policy in providing the full spectrum of health services to women and girls in the communities in which they work. We're seeing such a fear in this sort of overreach that this policy has that groups aren't even willing to coordinate and communicate with each other. If I, for instance, am working for an organization that's chosen to comply and you're working for an organization that's chosen to not comply, wouldn't it be better if we were coordinated and collaborated in our response in service to women and girls in the communities at the field level? But the policy is so kind of harm-inducing that we're not even having those conversations. I think importantly, and I know that Emma can probably speak to this better than I, that we see a real lack of donor coordination and conversation at the country level. You know, sort of who's stepping up and leaning in to say, how do we make a more cohesive and strategic picture for we know the healthcare and supplies that need to be delivered at the field level, and we unfortunately are not seeing that robust and sophisticated conversation happening amongst donors, particularly at the national level. We know global efforts like She Decides and others are elevating that conversation, but we need more of that. So that's a couple of examples. And I think the last one that feels a little new to me is that this policy is really going to embolden the opposition in country to sexual and reproductive health and rights. And as many of you know in the room, that's an opposition that has been quietly funded and supported by the U.S. Through various arms for many, many years. And now emboldened in the face of this expanded global gag rule, I think that we will see sort of a dangerous combination of not only sort of U.S. influence at the national level, but then local advocates becoming emboldened to speak out against the advancement of women's human rights in their own communities.
I love that you mentioned She Decides and how, you know, the donor community has stepped up. And I do want to come back to that. But first I want to go to Anu because IPAS has such an important role in the global community training providers and making sure that they can help women who do need access to abortion or post-abortion care. So Anu, can you talk a little bit about you know, how the Global Gag Rule or even other, you know, sort of U.S. policies that impact access to abortion are impacting the work that providers are doing in the field?
Yeah, I'd be happy to. So one thing that has not been mentioned yet in the remarks from Senator Shaheen is the Helms Amendment. And I want to remind us that we are still living in a time where the Helms Amendment exists. The Helms Amendment was proposed and implemented in 1973, which is the same year in which IPAS was started. And like PAI, IPAS also does not receive U.S. government funding. The Helms Amendment, just as a reminder, is a prohibition on the use of U.S. funding for abortion care. At least it's been interpreted as a complete ban on the use of U.S. government funding for abortion care. In fact, there are exceptions to the Helms Amendment that have never been implemented. Be that as it may, the Helms Amendment is in place, and on top of that, we have now the gag rule. And so the gag rule actually compounds the stigma that existed with the Helms Amendment. It's made it even worse. And it's made it even worse because it's not just about U.S. funding. It's about what organizations do with their private funding. So if you raise money as a foreign non-governmental organization from private sources, you are no longer allowed to use those funds for advocacy, for referral, for abortion care. So that's why it's called the gag rule. That's what's happening. So yes, money is definitely a big factor, and the compound stigma between the gag rule and the Helms Amendment is pretty profound. But what does that mean? Jamila, you're asking, what does that mean for providers and for women? So I think the short answer is it means two things. It means that women can't get the care that they need in the way that they need it, and providers can't give the care that they want to give in the way that they want to give it. So, you know, in a snapshot, what it means is that women who are seeking, for example, contraceptives and contraceptive care may have to go to one clinic and then go to another clinic or source for abortion care, even though the same provider in the same health facility should be able to provide both services at the same time. So from a very practical, pragmatic point of view, it means that women have to come back for care, they have to take time off work, they have to really sacrifice in order to get what is essentially basic health care. So from a very tangible point of view, it's challenging. It's also hugely inefficient. So imagine from the point of view of the health system, where you are, a health administrator or a hospital administrator, and you're providing services on reproductive health care, and you have the providers who are trained and able to provide contraceptive care. Those are the same providers who can provide and should be providing safe abortion care. But now you can't do that. Now you have to find a way of separating these two services, separating the money, figuring out how these clinics are going to operate because of this policy. So it's hugely inefficient, and really, as an American taxpayer, it's a hugely inefficient use of our tax dollars. So I think from a very pragmatic point of view, we have a lot of logistical challenges. And as Suzanne was indicating, the policy is sort of just beginning to be implemented, and people are just starting to grapple with what it means. And so there's a lot of confusion. The message that is clear, the message that has been communicated by this policy and through the Helms Amendment is that the U.S. government has and promotes an anti-abortion, anti-contraception, anti-woman agenda.
Absolutely. And can you talk more, that was precise and to the point. Another piece that I want to lift up, though, is the issue around unsafe abortion. I think there's some, at least in the domestic context, I think, a lot of times folks can be confused about how prevalent it is in the developing world. Can you talk about that?
Yeah. So globally, we know there are about 50 to 55 million abortions taking place every year. About half of those 25 million abortions are unsafe. So this is a very common medical procedure that's happening around the world. Thousands of women die. But where are those women dying? They're not dying in the United States. They're not dying in Western Europe. They're dying primarily in sub-Saharan Africa and in South Asia. So abortion, and why we care about abortion and the provision of safe abortion care, is because it's a matter of public health. These are not randomly distributed deaths. These are deaths that are occurring to poor women in poor countries. We care about abortion because it's a matter of human rights, specifically women's rights. That's why, since 1994, over 40 countries have liberalized their abortion laws. We care about abortion because it's a matter of changing and evolving social norms. The norms around what it means to be a woman, what it means to be a man, how to change society. And indeed, the stigma that I talked about earlier is part of those social norms. So from the point of view of what's happening in the world, abortions are extremely common. We care about them because they're a matter of public health. We care about them because deaths and injuries due to unsafe abortion are one of the 5 causes of maternal deaths that occur. And it is the only cause of maternal death that is completely preventable. We know what to do about this. We know how to fix it. We just haven't done it.
And I'll just also add to the point about unsafe abortions is that they do disproportionately impact younger women and girls. So just wanted to add that, and oftentimes, these are the populations that lack access to contraception, that may not be able to, this may interfere with their ability to go to school. And things like that. So also wanted to point that out. I want to shift things to Lisa with WaterAid. Lisa, your organization provides water, sanitation services, and good hygiene support for communities in the developing world. So tell us a little bit more about the programs that you offer in the field, as well as your decision not to sign the Global Gag Rule.
So we are definitely an unusual suspect on this stage. Happy to come into a community that's already strong and cohesive, that are able to welcome those of us who are implicated by the expansion of the policy this year. I think, Suzanne mentioned a number of sectors beyond family planning that are now impacted for the first time. Water, sanitation, and hygiene, or WASH. We have this very convenient acronym. It's also easy to pun if you'd like to play that game. WASH is one of those sectors that's affected for the first time, along with tuberculosis, neglected tropical diseases, nutrition, and a whole range of other services that you don't immediately think of as being linked to sexual and reproductive health rights. For WaterAid, WASH is very much an issue of women's rights, girls' rights, and gender equity. Women and girls face a disproportionately large impact from the lack of WASH. So we're talking 1 in 9 people in the world that does not have a source of safe drinking water at home, 1 in 3 that does not have a latrine. So this is a very, very large number of people in the world. And as with anything to do with extreme poverty, it's mostly women and girls that are suffering. And so for WaterAid, our service delivery and our policy and advocacy work are very closely connected intentionally. Our model is for them to be a feedback loop so that we're always operating in response to the barriers faced by the communities that we work in. And we work primarily through a partnership model. So we have about 1,000 local partners in the 37 countries in which we operate. So the potential ripple effect of a policy like this is really large. So, you know, for us, there's 2 kind of major issues that we felt would be impacted, 2 major priorities. The first is our work on WASH in health facilities. In the developing world, only 1 in 50 health facilities has WASH, with maternity units being particularly concerning. And again, as with anything that's specialty services for women and girls, likely to be overlooked in context of health facilities. And so we work a lot with maternal health organizations and SRHR organizations to kind of create the demand to close that gap. And the other is around menstrual health and hygiene, which is itself a sexual and reproductive rights issue. Very important component of comprehensive sexuality education, et cetera, that we all know about very well. And for many years, it's been viewed as an issue that can be handled just by building a latrine. And the WASH sector, I think with a lot of leadership from WaterAid and UNICEF, have said, no, that's just not enough. And so the progress that we're making in these 2 areas that, you know, I can talk more about the ripple effects of these 2 issues out into the rest of a woman's life, but the progress in those 2 areas is of huge concern to us, both from the global advocacy and local and national advocacy standpoint, but also from the service delivery side.
So has the decision, you know, to not accept the funding, has it made it harder for you to do the work? Or, you know, or either put you into situations where it's harder to work with partners in the field that may be accepting the funding?
Yeah, I mean, as we've been reminded, it's early. We have been fortunate so far to not have our funding, we do accept U.S. government funding, not to have that directly impacted. But we are starting to hear some pretty consistent concerns expressed from our country program colleagues. Things like the maternal health and SRHR partners are no longer coming to WASH policy coalition meetings. Or in the reverse, that the maternal, newborn, and child health policy coalitions that we're part of are seeing some fragmentation. And that really is going to create a huge barrier to taking forward these kind of proactive steps forward on gender equality that we've all been trying to do together. You know, a health system is ideally integrated. We shouldn't have women going to multiple clinics for multiple services. You know, and as Senator Shaheen said, this policy targets the most effective health organizations that actually have the capacity to be a hub for all of these other partners to come together. And so we're very concerned that a chilling effect in advocacy is going to translate into a reduced number of services that we're hoping to contribute to.
I think a key point that you make as well is that, you know, and all of you have made so far, is the fact that it's not only impacting, you know, the family planning and reproductive health providers. You know, we're seeing the ripple effect even for groups that are, you know, working at the intersection of these issues, and so thank you for that. So I did want to shift a little bit and talk about, you know, how we're seeing some resistance to Trump's global gag rule. And so I wanted to shift things to Emma here, and just wanted to start off because you have your She Decides pin on, which looks amazing. And I wanted you to start off by talking about that movement, because it's something that has really grown over the last year or so, and has made a real dent into the international community when it comes to resisting this policy.
Yes, I'll be happy to do that. May I just first add also the perspective of other bilateral donors on how Mexico City policy also affects us, because Sweden cooperates with USAID and US agencies in partner countries, and we often finance the same local NGOs.
Right.
And what is detrimental with Mexico City policy is that it prevents our taxpayer money to be used by these local NGOs and do what we would like them to do on our sexual reproductive health and rights.
Absolutely. So yes, start there and talk about that.
The Swedish Agency for Foreign Aid, SIDA, actually this time has developed a guidance note for how to deal with Mexico City policy, and this is the first time that they have done that, and it's because of the expanded part of Mexico City policy, because now it affects so many more of our programs, and so many more of our staff needs to be informed about Mexico City policy. So we have now a guidance note that talks about what the policy is and how it affects us and how we should deal with it. And SIDA has actually made the conclusion that when or if local NGOs decide to sign on to Mexico City policy, we will have to look at if we can continue to finance them, because the key for us is that they can deliver on our SRHR goals. And this is not a black and white principle, and the purpose is very much not to put local NGOs in a situation where they have to choose. And if it would come to the situation where SIDA feels that this NGO can no longer deliver on our goals, we will do the withdrawal in a very transparent and responsible manner. But this is just to add that that the policy also affects allies of the U.S. that work together with the U.S. In the field. And I also want to add that Sweden has a very good dialogue with USAID and state on these issues, and we try to put forward what we see happening in the field. So for the 6-month review report, we provided input both from SIDA and from the Foreign Ministry to share our perspectives and our concerns.
Can you talk a little bit more about, you mentioned that, sexual and reproductive health and rights is a priority for SIDA. Can you talk a little bit about how that is sort of built into the values and the policies of the government?
So then coming back to that, the Swedish government in 2014 declared itself as the first feminist government in the world.
Wow.
With feminist foreign policy. And this stems from the conviction that men and women should have the same options to shape society and their own lives. And it's been a fantastic journey for me as a feminist working at the Foreign Ministry to be part of that and to try to carve out what the feminist foreign policy really is. So it started out with a 3-page paper that Sweden should always look at the rights, representation, resources of women and girls when we do foreign policy, in our design of projects, in our analysis, and when we look at results and monitoring. So it's been a journey that is really interesting, and we're actually going to have a conference in Stockholm in April that tries to sum up what 4 years of feminist foreign policy has actually achieved and how we want to take it further. So in April, we're going to have the Stockholm Forum on Gender Equality.
Amazing.
And just want to add 2 more points, and that is it's really important for us to live as we learn. So we also work very hard internally to ensure that we also prioritize gender equality within our own organization. And it actually took a feminist foreign government to appoint our first female ambassador to the US. So I'm very proud that we now have our first female ambassador working with us. And the second point is that it's also very important to involve men and boys in this work, and that men and boys are key actors of change. And I often say that I'm a mother of 2 sons, and therefore I'm a feminist, because I want them to be able to choose who they want to be and not have to abide by stereotypical masculinity norms.
Absolutely. And so another aspect, I definitely want you to talk about She Decides as well, but an aspect of that movement is also donor commitments from other countries, you know, to sort of help fill the gap where funding and resources could be lost to support sexual and reproductive health and rights, and Sweden is a part of that. Can you talk a little bit about that?
Yeah, so one of our key objectives with our feminist foreign policy is to work with sexual reproductive health and rights issues. Sweden, together with Denmark, Holland, Netherlands, and Belgium, launched the She Decides initiative in Brussels a year ago. And the purpose of this movement is to be for sexual reproductive health and rights issues. So it's not an anti-Trump movement. It's actually to promote and galvanize political and financial support for the SR and HR agenda writ large. And I think it's important to emphasize that sexual reproductive health and rights is not like a small health issue. It's a rights issue, and it's also a development issue. If women cannot choose when to have children, if they cannot protect themselves from sexually transmittable infections, they cannot be economic agents. And we need women to take part in economic development in order for us to deliver on the Agenda 2030 and the Sustainable Development Goals. So I think that is the underlying parameter for She Decides. And the purpose is to be a partnership model that gathers individuals, UN organizations, governments, philanthropists, private actors. And She Decides has a web page with a manifesto that everybody can go on and sign on to, and I encourage everybody here to do that. And
the website, She Decides.
SheDecides.com.
Okay, SheDecides.com, so everyone can go there and sign up.
And so far, the movement has gathered $445 million US.
Oh, amazing.
But this should still be viewed in the perspective of the Mexico City policy that could possibly affect 8.8 billion.
Right.
So She Decides cannot fill the financing gap on its own. And I think it's just important to have that perspective.
Absolutely. Thank you for that.
Can I just say
yeah,
that
absolutely.
I just want to appreciate that Emma, with such candor, talked about some of the complication of this sort of the donor coordination and sort of stepping into this gap question. And that when I was talking about kind of lack of donor coordination at the national level, it's sort of thinking of the example of CETA and other bilats who can really foster those conversations, but also the private philanthropy side and how much work there is still to do to sort of understand, you know, what is the gap overall, what's the needed envelope that nobody really needs or wants credit for filling it. We want it filled in order to provide the services and the supplies that are so life-saving. So really holding up the CETA example as one that I think other donors should sort of follow into. And so I appreciate that you put such a light on that.
Absolutely. And a question for the whole panel, because for me, even just looking at the example of She Decides was just very motivated by, this effort where folks are really organizing in opposition or to resist this issue. Can you all share any stories in terms of what you may be seeing from the women and organizations you're working on the ground in terms of how they may be resisting this policy, or at least in terms of the conversations that you've had, little nuggets that you can share? Because for me, in prepping for this panel, that is something that kept popping up, how folks on the ground are responding to this. Because even, before the Trump administration, there were definitely, folks on the ground were nervous about the work that they could do in this space. So just wanted to see what you all had to share.
So I think it's important to remember that this version of the gag rule comes on the heels of 8 years of no gag rule.
Yeah, right.
And 8 years of tremendous progress for sexual and reproductive health and rights, and 8 years of a lot of momentum and a lot of building and a lot of movement. So what I have seen the most is essentially a refusal to go backwards, and a refusal to be bullied by this administration, and frankly by the U.S. government as a whole. And so, the conversations that I've had with partners with donors are really about not going backwards. That this is not the moment that we can go backwards. We're actually making tremendous progress, and I think that's often very difficult for Americans to really see because we're so beleaguered in the United States of all the attacks on reproductive rights and justice in this country. But in fact, the world is a different place. The world has actually moved and progressed and is supportive of these issues of sexual and reproductive health and rights issues, so much so that we actually have not one government, but two feminist governments. Canada has also joined Sweden in this effort. So, you know, I think what we're seeing is a energy around this that's not easily put down. Now, it's not without its challenges. And I think one of the challenges that we still face is confusion around how things are going to be implemented around, you know, you were mentioning, or one of the panelists was mentioning about advocacy. And I think one of the real concerns is how vocal can organizations be? So we have a lot of fear, we have confusion, we have some degree of censorship. In our own work in Malawi, we have seen where a coalition of organizations that are working to reform a very restrictive abortion law. In Malawi, we have very high levels of maternal mortality. We have very high levels of adolescent pregnancy. We have very high levels of death due to unsafe abortion. And we have a coalition that's been working to change the law in Malawi, and they've been working together for years on this matter. And now with this policy, they are worried. And in fact, so much so that they've actually, some of the partners are stepping back. And it's because they've been given an ultimatum that they either have to choose between U.S. support and funding or talking about abortion. And just one other point, it's not just about the money. The money is very, very important, don't get me wrong. $9 billion is very difficult to replace. Thank you, Sweden, but it's not going to be enough. But the money is only one aspect of this. Commodities are a huge aspect of this. And when I say commodities, I mean things like contraception, condoms, implants, IUDs. We've seen in our own work at IPASS where a partner has actually withdrawn support from withdrew from a partnership with us because they felt like they couldn't work with an organization that focuses on abortion, and what they've taken away is contraceptive supplies and commodities from us. That's not even necessary under the gag rule. There's no provision that says you have to do this. But the confusion and the fear is leading people to act in this way. So those are some of the things that are also sort of tangible but intangibles. We often talk a lot about the money, but the commodities are also important, but then also the technical assistance that's provided by the U.S. government. These are very important aspects of our leadership, the leadership of the U.S. government in these issues, which is completely absent.
I would pick up on your point about the refusal to go back. I think, you know, for WaterAid, this has been a really interesting journey because, as I say, we are not an SRHR organization, and probably most of our staff had no previous familiarity with the gag rule. Even just the process of very intentionally partnering with SRHR organizations is at various stages in different countries. And, you know, on some level, it depends on the policies in the government itself, the service delivery that is prioritized, the personality and experience of the staff and how comfortable they are. We've been really fortunate to partner with and be supported by the government of Sweden, the Swedish foreign policy, and now the Canadian foreign policy as well, which has helped to kind of shape our internal strength, I would say. You know, it really bolsters and provides leadership in, with governments that we've already had longstanding partnerships with. But the advocacy side of things and that concern about what we can say is really important. We worked really, really long and hard to ensure that WASH was integrated across the SDGs. We advocated very strongly for a menstrual health and hygiene target, which we did not get, because we felt that that was an extremely important proxy indicator of how well our sector was doing on gender equality. But there's been a massive movement in the WASH sector to really step away from the idea that dropping a borehole is in itself success, and to measure success based on outcomes, particularly around the health of women and children. And we've even seen USAID come along with that. The Water for the World Act that was passed unanimously by Congress in 2014 specifically emphasizes the impact of WASH on women and girls, and specifically demands consultation with and participation of women and girls as leaders in designing programs. USAID has taken it a step beyond that even. The administration, approved by the White House, so we have something to hold them accountable to, released in November the first whole of government global water strategy. USAID's component includes menstrual health and hygiene. USAID and CDC have committed to working on WASH and health facilities with a stated intention of addressing maternal mortality and newborn mortality from preventable infections. So as a global community, we have taken this very strong stance that we intend to move forward together. We intend to break down the sector-based silos. We intend to push ourselves. We intend to focus on equity. And this policy jars us back. And I do sense that they're really, across whatever sector you're coming from, there's anger and that sense of being bullied, that, you know, the SDGs represent a consensus from civil society around the world that we won't go back. And then here we are being confronted with this fear and this challenging position of how strong can we stand without compromising our mission. And so I think it's still to be determined, but that commitment to a mission that is fully meant to serve poor and vulnerable and marginalized women and girls, and to eliminate a human rights violation that is preventing their full empowerment, you know, I think that has come forward as a bottom line.
If I could, I would again mention the Uganda and Nigeria case studies that are released today on PAI.org, and they are replete with quotes from service providers, advocates, ministry officials in both of those countries. Ethiopia will be forthcoming in a few months. And what we hear echoes this. We hear a lot of frustration with just how irrational the policy is. You know, it's not life-saving. We have obscenely high rates of maternal mortality in my country, and then all of a sudden you tell me I can't provide comprehensive sexuality education, I can barely provide contraceptives. You know, the sort of supply chain in country is disrupted because UNFPA has been defunded by the US government, and now USAID is a huge donator of contraceptives in many countries. So that first, just frustration and confusion, and how that doesn't, the dots are not connecting, so to speak. I think the second thing you hear is fatigue at the administrative burden of this. And that's, of course, any organization's job is to comply with policies and protocol. I get it. Except when the policy is totally unclear, is sort of like in sort of rolling stages of sort of what it means to implement it fairly and justly. So groups are spending inordinate amounts of time, of staff time, board time, legal time, as opposed to providing services to women and girls who are in need. So that's a real, you know, I don't want to put, that's a real challenge for groups, and any of us in the room can experience, you know, can sort of appreciate what that feels like. And then I think the last is, and this is sort of a broader point about the space for civil society, not just in the US, but around the world. We cannot overstate the chilling effect of this policy and how it, quite frankly, just kills conversation. It kills partnership, coordination, collaboration, makes people afraid to talk to each other, makes people afraid to fill gaps and problem solve together. I think that's significant, and we see that not just in SRHR, and actually not just in global health, but really across the development sector, is this sort of retrenchment of space for civil society voice and participation. And so if we have our eye on the big prize, it's really funding this idea of civic engagement and helping individuals around the world get involved in their policy making and political process. And we know that that will be, the true north of that will support the cornerstone issue of women and girls' health and rights. But there's some precursor work that needs to happen, and I think the Global Gag Rule is sort of laying bare some of that complication.
And could I just jump back in just to pick up on the point about this goes beyond the global health sector. So there has been a lot of confusion about whether or not WASH is actually caught up in this, because it's a very unique sector in that it's jointly funded by development assistance funding and global health funding, as this recognition that it cuts across global health and poverty reduction priorities for the U.S. government. And so it's the health components, not the dropping a borehole, which is actually development assistance funding and is exempt from the Global Gag Rule. It's the stuff that makes those things work, primarily the behavior change communication and hygiene, that is actually implicated. But then add to that the fact that the White House has now for 2 years requested the complete elimination of the development assistance account. Right. And so I think it's really important for people who care about global health to understand that that is going to impact the success of what you are working on. Case in point, we have a potential challenge coming where a USAID partnership is considering whether they need to add global health funding in order to safeguard the program in case development assistance account is eliminated, which would turn something that is supposed to be exempt from Global Gag Rule into a program that WaterAid can no longer implement. So it's really important that we do think about this across the spectrum of what civil society is trying to do. It's not just global health or development, it's all of it wrapped up. And to the extent that anybody listening who works on appropriations on the Hill can kind of join us to say, save the development assistance account, we would be grateful.
Yes. Yeah, go ahead.
May I just add 3 short points on this? I think just adding to the administrative confusion, that a bizarre effect is that CEDA has to spend a lot of time in the field explaining what Mexico City policy is to local partners, because they are partly afraid to go ask USAID because they want to safeguard their funding, and also because USAID is also still confused. And I think that is also recognized in the 6-month review report by State Department, that there still needs to be clarifications made. So there is an administrative burden to donor partners as well. And secondly is the disintegration of health services that you've touched upon as well, that we've worked for so many years to create one-stop shops led by local governments and local partners to make health services much more efficient. And Mexico City policy really works in the opposite direction, where we can't deliver all services at one spot. And the third point I want to make is about polarization, that you create issues in the field where some organizations sign and others don't. And I think it's really important to give voice to the organizations that have felt compelled to sign on, who are in a situation where it's much harder for them to voice the problems that they experience with having signed. And I think we all share the responsibility to try to facilitate dialogue and a safe space where organizations that have signed and not signed can come together and talk about this.
And we have time for one more question before we go to audience Q&A. What kind of signal does this send to women around the world, knowing that, the United States has not only reinstated the Global Gag Rule, but it's expanded. So it could be impacting, services that they need across the board. What do you all think that this is, the signal that this is sending?
I mean, if there were the Global Gag Rule in isolation, we've sort of laid out what signal it's sending. Unfortunately, it's not. It's this whole host of attacks that you've chronicled, that Senator Shaheen talked about. It's the erasing of certain key vocabulary words from State Department human rights reports. I mean, it really is the sort of erasure of women and their autonomy, their integrity, their contribution to the paid labor workforce, the degree to which they help stabilize and make more secure countries. It's parsing words, it's changing vocabulary, it's shifting out sort of terminology, not human rights, but individual rights and human dignity. Sort of changing the record in a way that very clearly sends a signal. And if you don't have the good fortune of traveling as much as those of us on this panel do and have talked with, women and girls and boys and men all around the world, they watch the U.S. and its leadership, and it's leaning into this role of moral authority a lot and very closely, and they get the complicated cocktail that they're being fed right now, and know that they're being erased and not counted. I mean, I think the signal
Not
is
valued. Yeah, that's
valued.
what I was thinking.
Yeah.
Anyone else want to?
No, I think I think the overall message is the U.S. government doesn't value you.
Right.
Yep.
Doesn't value your contribution, doesn't value your voice, doesn't value your participation in political life, in economic life, in social life. And you know, I think that's why you see such a backlash against it, because the world has moved on from that. You know, no one is willing to have that conversation anymore. We've had that conversation and it's over. So I think that's why we see governments like CETA, like Sweden and the other countries step up and say, no, we are firmly and strongly behind the rights of women.
And I'll just add too, I mean, we don't have a voice from the field necessarily here, but I think another sort of dynamic to this issue is the fact that the organizations or the people that are working, you know, on the front lines are people that see women die in their communities. They see women come to the clinics in which they work and they need access to contraception or they need a safe abortion. In some cases, because of policies like this, they're not going to be able to help them. So with that, I do want to open up because I can tell that there are probably some questions out there. Folks look a little bit anxious. So my colleague Taylor here has the mic. We do ask that folks ask our lovely panel here questions as opposed to making any statements today. So here we are. Start here in the front.
Hi, Jill Gay, What Works Association. Would all of you comment on the new UNESCO sex ed guidelines that do, for the first time ever, mention abortion? And would all of you comment on the role of the UK in this, in the issues around the Trump Global Gag Rule?
So I am aware of the UNESCO curricula change and the fact that it does for the first time include safe abortion or mention of abortion. So that is a very positive step. And IPAS has actually been looking more into the issue of comprehensive sexuality education as a precursor to preventing unsafe abortions. The challenge, though, comes in, it's one thing to have it in the curricula, so that's great that it's in the curricula. It's a whole nother thing to actually see sexuality education implemented in schools around the world. So one thing that we know happens is that somehow the chapter on abortion gets skipped, or the information around contraception is simply omitted, or we run out of time when it comes to those issues. Just like when I was learning about U.S. history, we always run out of time right before the Vietnam War. So, you know, I think the challenge is going to come in actually implementation of that curriculum, but it is definitely a step that's included. And then your other question was around the UK government. So I think Emma probably has the best response to that. I do know that there was an all-parliamentary hearing recently, and a report was issued from that meeting, and it was quite interesting and positive. So I think they're still with us.
Well, it's hard to talk about another country's policy. I can just say that we're traditionally very, very like-minded with the UK on SR/HR issues, and my colleagues here, which is the perspective I have, participates in the same meetings that we do and work together with us on this.
We know that DFID has been enormously generous and a real leader on this issue. We also know that at the national level, there's been some degree of political turmoil and confusion and some real questions about the value of foreign assistance, not unlike the conversation we're having here, very regrettably. We do watch and admire their participation in FP 2020 and related efforts. And I also think that, sort of back to that confusion at the national level, because DFID missions and UK missions tend to have quite a bit of independence and autonomy, then it makes it doubly hard but doubly important to communicate to all of those mission and national level offices what is this policy and how does it impact our funding and what can we do to lean into donor coordination. So if I were asked to deliver a message to DFID and the UK government, that may be part of it.
We have a question up here in the front.
Hi, I'm Sam Rick with the Frontline Health Workers Coalition. I was just wondering if you could speak more to the effects on health workers, particularly rural health workers. Are they sort of choosing to remain in the integrated facilities and not provide services themselves? How are they like voluntarily splitting up? Is there one person per community that's taking on all of the abortion and post-abortion care? How is that affecting them?
Anu, you want to take that one?
Yeah, I mean, I think we don't yet quite know what's happening because very often, as you're just saying, they're the single provider or the sole provider in a community, and so they're doing everything, you know, from immunization to tuberculosis to the whole gamut of care that needs to happen. So you know, I think they're continuing to provide that care and providing it as best they can, but it's a little bit too early to say how the policy is actually going to filter down to that level. I do know that in Kenya, we had a situation where after the gag rule was announced, a clinic in Kenya put up a sign saying, "No abortion offered." So this is in a country where we have 1 million unintended pregnancies every year, and women are still dying from unsafe abortion. So, you know, the providers interpret the policies as they can.
Looks like we have one in the back.
My name is Ed Whitson. My affiliation is with my wife Debbie and my daughters Becca, Kristen, and Tessa.
That's
Senator
a strong affiliation.
Senator Shaheen had said that, of course, we could deal with the problems laid out today by flipping the House and the Senate voting. Beyond that, my question basically is about activism and active resistance and what regular people in communities across the country might do. I think, for example, of the West Virginia teachers. I think, for example, of the counter-protesters against the alt-right and the KKK in Charlottesville, and of course the high school students in Parkland, Florida. I assume your organizations have talked about activism and resistance. So the question is two parts. Do you consider that to be productive or counterproductive? And secondly, if productive, what do you recommend that all of us do to try to deal with these problems laid out today? Thank you.
The activism.
Yeah.
Suzanne, you want to start?
I mean, as an organization 100% dedicated to evidence-based advocacy, I believe deeply in the art and science of activism. And I guess I'll sort of take about it from the international perspective and what we see sort of happen in the 30+ countries in which we work, and I think there's lessons learned for here. I'd love also to hear from Emma as she decides is really aiming to be kind of a grassroots mobilization around these issues. I think one is understanding like the sort of the reach and import of your voice, and saying that over and over again, the degree to which we're getting new voices, new individuals, new ideas engaged in civic discourse around the issues that impact us all cannot be underestimated. I mean, and the Florida shooting is sort of a great example of that. You know, here to unactivated high school students, like literally overnight, shifting a national dialogue and discourse around firearms and guns. So I think that you can't forget that, and we see that happen at the national level in places where civil society and activism has not been prioritized and not been allowed the space and the time that it deserves. So I would say one is just sort of connecting the voice, and I would say kind of from a nonpartisan perspective, that there is an ability, we do have the capacity to embed this issue across political parties. Yeah. PAI was founded by Republicans in 1965, and we know that there used to be bipartisan support for access to contraception as a means of doing all sorts of things, advancing women's human rights, reducing the incidence of abortion, building strong and prosperous countries. So I guess I try not to lose sight of, South Texas girl, I try to not lose sight of the ability to persuade and bring to a shared space the importance of human rights for women and girls across the political spectrum, both here in the U.S. and around the world. So that's my activism answer.
Well, and I would also add that this iteration of the Global Gag Rule, more than any other time, can be discussed with people who have all different perspectives. You do not have to talk about the impacts of unsafe abortion in order to talk about how this policy is bad for women and girls around the world, which has a direct impact on public health, on national security, on economic growth, lots of other things. But I do think that for those in this country who know that this policy exists, what they know is the rhetoric. They don't know the facts. And I think there's a lot of value for people to learn just a little bit more about what this really looks like for the human beings that feel the brunt of it. Be able to talk to your friends and your family, write an op-ed in your local paper. If you have relationships or are willing to build relationships with the in-district offices of your members of Congress, tell them you care about it. And you can pick any global health issue that you think they're willing to hear about. It doesn't have to be that you're concerned about the unmet need for family planning. You know, water, sanitation, and hygiene enjoys very strong bipartisan support in this country. Maybe that's a good entry point depending on where you live, who your faith community might be, who your member of Congress might be. This policy really affects the ability of the United States to be an effective and efficient contribution to the kind of global aid architecture. And it is, I think, as I think it was you that said, partly to do with effective use of taxpayer dollars, which, you know, puts the ball squarely in the court of any activist who wants to pick it up.
I think I agree with everything you said. I do think that you should also be talking about unsafe abortion.
Yes.
You know, even if, you know, sanitation or other development issues are the entry point, I think that we cannot lose the fact that this issue is causing women to die, and unsafe abortion is at the center of that. I know Emma wanted to also respond to that question.
Yeah, I think She Decides is a movement for everybody. So I would encourage everybody to sign on to the manifesto and to start addressing the issues and talk about it. And then narrowly, more focused on just the U.S. and the Mexico City policy, I think it's important to have a constructive dialogue with Republican representatives that the expanded part of Mexico City policy is really harmful. So, because I think the Republican Party will always, for the foreseeable future, hang on to Mexico City policy, and it's really important that the expanded version does not become the blueprint for future Republican administrations. So that is what I would encourage you to do.
Let's go to Anu.
Just two quick things. So when I was talking before about the refusal of others to go backwards, what I think would be really productive would be to stigmatize the U.S. government. Reverse stigma can be quite powerful and important, and I think we are seeing the beginnings of that, in fact, in the She Decides movement and in the refusal of other countries, other ally countries, to comply with the American policy. So I do think that reverse stigma is a useful thing. And then, you know, I'm a big believer in asking questions. I'm sure you are too. So one of the questions that I'm sort of pondering, and I have pondered for years about this, is what is the U.S. government so afraid of? You know, these policies are based on a position of fear. There's a fear of, you know, I think around women's activism, women's rights, the ability for women to actually be full productive citizens. And so why is that scary?
I feel like I can't even say anything else now. I mean, yeah, it's just the mic drop. So I don't know if we have any other questions. It doesn't look like we do. So I want to close there because I think that's such an important point to leave you all with. You know, why is the U.S. government so scared, you know, of women taking over the world?
Day.
On International Women's Day.
Right.
So I want to thank this brilliant panel for being here today, and Senator Shaheen for taking time to come out and greet you all and talk to you about this important issue. I hope that you all leave here inspired. I know that I am from listening to these wonderful women talk about these issues and the great work of their organizations, and speak up about this issue. You know, I think the conversation around activism and resisting is important, particularly in this political environment, and there are opportunities for all of you to engage on these issues, both domestically and internationally. So continue to fight for women, and if you're not already doing that, I hope you get engaged. Thank you all for being here today.